Assalamu alaikum everyone. Today's video is a continuation of my previous lecture on infective endocarditis. In this video, we will discuss the investigations and management of infective endocarditis. So let's start with the investigation. The most important or the most accurate investigation in the infective endocarditis is blood culture, which is also a major Duke's criteria. Blood culture should be taken at least 3 samples before starting the antibiotic therapy and with the proper aseptic measures. The next important investigation is echocardiogram. It is the key investigation to check the progress of valvular pathologies and also to check the endocardial abscesses or endocardial vegetations. Remember, the most important point here is that transesophageal echocardiogram is much more sensitive or specific than transthoracic echocardiogram in the infective endocarditis. But we have discussed in the congestive cardiac failure that in the congestive cardiac failure the most important is echo transthoracic echo, but here in this condition in the infective endocarditis transesophageal echocardiogram is more important. Other non-specific tests include complete blood count, which shows the leukocytosis and anemia, especially in the subacute infective endocarditis. And there is check the UCE, that is urea, creatinine, and electrolytes, because we know that sometimes the immune complexes are deposited in the kidneys in subacute infective endocarditis and causes glomerulonephritis. So the renal function is very important to be checked. And the other non-specific investigations are C-reactive protein, which is more reliable to check the inflammatory process in the body than the ESR, that is erythrocyte sedimentation rate. So this CRP is important to check the progress of the disease. The other non-specific test includes urine culture and urine detail report, because to check the proteins in the urine because of glomerulonephritis. And also we know that UTI is also associated with infective endocarditis, so urine culture is also important. ECG shows sometimes the AV nodal blocks and conduction abnormalities, and chest X-ray shows sometimes cardiomegaly because of congestive cardiac failure in severe cases. So these were the investigations in infective endocarditis. Now come to the management or the treatment options. The first important treatment options includes the empirical therapy. Empirical therapy start before the culture results. In case of acute infective endocarditis, in if the empirical therapy is give the patient vancomycin. Along with the vancomycin, give the patient gentamicin. So vancomycin plus gentamicin is important empirical therapy in acute infective endocarditis. For subacute infective endocarditis, remember the mnemonic CG, BG, and AG. CG is basically ceftriaxone, which is third generation cephalosporin plus gentamicin, and BG is benzyl penicillin plus gentamicin, and AG is gentamicin, ampicillin plus gentamicin. This ampicillin plus gentamicin combination is more important for enterococcus bacteria. Now come to the prosthetic valve infective endocarditis. Here give the patient vancomycin. These all are the empirical therapies. Give the patient vanco plus gentamicin plus rifampicin. These are the empirical therapies for prosthetic valve infective endocarditis. And the other combination can be used as vancomycin plus gentamicin plus cefepime. This cefepime is also a cephalosporin drugs. Now come to the organism specific drugs. For the Streptococcus viridans or the HASEC, that is Haemophilus actinobacillus, Cardiobacterium, Echinella, and Kingella. These organisms give the patient because these organisms cause subacute infective endocarditis. So for all these organisms, ceftriaxone is the drug of choice. So ceftriaxone, that is third generation cephalosporin, is the drug of choice for viridans and HASEC category, for HASEC microorganisms. For Staph aureus, because if the Staph aureus is penicillin sensitive, then give the patient neficillin, oxacillin, or methicillin. But if the patient is penicillin resistant, then switch the patient to vancomycin. because the Staph aureus is the major or the most important cause of acute infective endocarditis. So give the patient vancomycin. And for Staph epidermidis, vancomycin is also in cases of Staph epidermidis. And for enterococcus, as we have discussed previously, that ampicillin should be used in the enterococcus infective endocarditis infections. And for fungi, amphotericin B, amphotericin B IV should be used along with the valve replacement. Valve replacement. Now come to the surgical interventions. So immediate surgical treatment is needed in cases of if the patient develops the heart failure because of valvular diseases, and also if the antibiotic therapy is failed and patient has endocardial abscesses formation or large abscesses on the left side of the heart, and also if the patient has prosthetic valves in the heart, also if the patient has fungal endocarditis. So surgical immediate interventions are needed in all these cases. Now come to the prophylaxis. If the patient is penicillin sensitive, give the patient amoxicillin. But if patient has penicillin allergy, then clindamycin is the drug of choice for prophylaxis if the patient has penicillin allergy. Now come to the conditions that in which the prophylaxis can be used in the procedures of prosthetic valve, in the transplant cardiac transplant recipients associated with valvular disease, congenital cyanotic heart diseases, and previous history of endocarditis. These are the cardiac procedures in which prophylaxis is important or needed. The other procedures in which the prophylaxis is important are dental procedures and respiratory procedures like taking the biopsy from the respiratory mucosa. So in all these procedures, prophylaxis is needed. In the some procedures, prophylaxis is not indicated and it is contraindicated, which are GIT endoscopy, cystoscopy of the bladder, and ERCP, that is endoscopic retrograde cholangiopancreatogram, gynecological and OPS procedures, and valvular heart diseases procedures. This point is very important to be remembered, that prophylaxis should not be given to the procedures of valvular heart diseases, but it should be given to the cardiac transplant recipients associated with the valvular diseases. So this was whole about the investigation and management of infective endocarditis. Thank you so much for watching this video.